Right now, healthcare is facing a structural crisis, and rural healthcare is under enormous pressure. We're at the point where we can't build and hire our way out of where we're at as a country. So the only way out is innovation.
I think the only way that we're going to be able to make concrete changes is to do care in rural areas differently, and research and innovation is paramount to changing the way we practice medicine in rural environments.
Resolve is unique because it approaches innovation differently. Most of the time when research and innovation happens in medicine, it tends to happen in large academic medical centers. They're often in very urban environments and then being disseminated to our rural communities. And if you design innovation in that way, it doesn't fit and it doesn't always work when it shows up in rural communities. Instead, what Resolve is about is doing bidirectional innovation. It engages rural communities, caregivers, providers, and patients as partners in that innovation, and that's a fundamental transformation for the field.
is in a really unique position to lead rural health initiatives within Resolve because we educate Montana's healthcare workforce. 60% of our resident graduates practice in Montana. If you look across the state at who the healthcare leaders are, they all have a degree.
The University of Montana generally and as individual faculty have really worked to foster close relationships with clinicians in the community. One of our strengths is really that community engaged approach to make sure that any new innovation that comes through the pipeline really makes sense in the context of a rural community.
Providence has an enormous rural health clinical network, and we have a lot of data that comes out of that care every day. The Resolve partnership really gives us the ability to activate the learning potential of that engine. Working with the researchers at the University of Montana, we can use that data to give us new insights into what's working and what isn't. And the Resolve partnership gives us that scientific muscle to make sure that we use our data to really understand what's happening in rural communities and then act accordingly.
The University of Montana has worked to be this trusted entity in rural communities. We have this multidisciplinary team of researchers that we can bring to the table, and the Providence network really allows us to take some of those research questions and I think really accelerate the potential for implementation and really leverage the expertise of researchers, of Providence clinicians, using Providence data and also harnessing the expertise in communities themselves.
Resolve is transformative and unique because of the shared why. The why is, how do we do better for our rural populations with the unique barriers that rural patients face? We have two institutions that are uniquely engaged in rural populations that have different skill sets and strengths. So by uniting Providence with the University of Montana, we've created something that I believe is really special.
One of the most important things for us is that we want to create a research network that is responsive, that we've developed the trust, the network, the overall infrastructure that we can accelerate the deployment of those technologies to get those to rural communities and ultimately see the fruits of those technologies being implemented there and not leaving communities behind.
We're sending a signal to the world that we've got a new way to do innovation and research in healthcare, and one that is deeply informed by the needs and the wisdom of our rural communities. And that's a very different model than how innovation has tended to happen. What we're going to see happen is that we are going to be moving new innovative ideas through the Resolve playbook and getting them into action much more quickly than we've ever been able to do before, and extending the reach into communities that have never been able to get to before. Resolve is an architecture for a new way to do innovation in healthcare. It's the roadmap for how we build the healthcare system of the future.